Your scan says polycystic ovaries and suddenly you're worried you have PCOS or ovarian cyst? Let's stop right there. I'm Dr. Siva. Let's talk about PCO, ovarian cyst and the PCOS difference today. PCO doesn't mean you have an ovarian cyst and PCO doesn't mean you have PCOS. First, let's see the difference between a polycystic ovary appearance on the scan and an ovarian cyst. The round dots that you see on the scan report, they are not real cysts. They are normal follicles, the eggs your ovary hasn't released yet. The PCO follicles are harmless, painless, and they are part of the normal ovary. So, PCO, does it cause pain? No, it does not cause any pelvic pain or discomfort. You'll be surprised, 1 in 5 healthy women have PCO appearance on the scan, especially teenagers, women under 30, women with naturally high egg reserve, women who recently stopped the pill. They all can have an PCO appearance on the scan. Does that mean they have the PCOS? No, it's not a disease by itself. It's just a normal variant. So what is an ovarian cyst? An ovarian cyst is a fluid-filled sac that is in the ovary that can grow, resolve, twist or burst and can cause pain. The ovarian cyst is managed by the gynecologist based on a woman's age, the cyst size and the features inside the cyst on the scan. Sometimes they do a blood test called CA-125 to correlate with the ovarian cyst. It's completely a different condition to the PCO. What actually is polycystic ovary syndrome then? It's a metabolic and hormonal condition, not just a scan finding. We follow the Rotterdam criteria for diagnosis. There are 3 criteria and women should satisfy 2 criteria to be diagnosed as PCOS: irregular absent periods or hyperandrogenism in terms of acne, chin hair, hair thinning, or raised testosterone free androgen index on the bloods. And the third one will be the polycystic ovaries on scan. So if you have a PCO appearance on the scan but the periods are normal, hormones are normal, then you do not have PCOS. Why does the misdiagnosis happen? Because a PCOS appearance, that a polycystic ovary appearance, is mistaken as PCO syndrome. A scan alone cannot diagnose PCOS. That's very clear. Symptoms and hormones matter more than the scan picture alone. So let me reassure that symptoms and hormones matter more than just a scan picture of a polycystic ovary appearance. So when to suspect polycystic ovary syndrome then, doctor? You would ask me. So if you have cycles shorter than 21 days, longer than 35 days, acne, chin hair, hair thinning, high testosterone, free androgen index on the bloods, difficulty conceiving, difficulty losing weight, insulin resistance features, that's when we investigate further for PCOS. So remember, if you have an incidental finding of polycystic ovaries on the scan, you shouldn't worry. That's the bottom line take-home message today. So check with your GP, family physician or gynecologist wherever you live, whoever you have access to, and discuss if you have any pelvic symptoms, metabolic symptoms, hormonal symptoms that bother you. And ask questions and get clarified rather than worrying yourself and Googling yourself. You deserve answers but not fear. Stay tuned.